ACT Health is the public health department in the Australian Capital Territory. We're responsible for stewardship of the public health system, responding to public health issues such as COVID-19 or communicable diseases, and all the ICT services across all the hospitals in the ACT. As the Chief Information Officer for ACT Health, really my role is to see how we use technology across the public health system. How do we ensure that technology actually helps clinicians provide better care in our hospitals? How do we ensure it works for our community-based staff? Also, how does it work for patients and citizens? We've really enjoyed working with Connected Health. What they've enabled us to do is bring a whole range of technology partners together to solve business problems that we've got today. And we found they can bring hardware and software vendors together and provide me with a single solution that just works. Whether that's Duress for recording what's happening and to get assistance for staff members, through to simple communications and everything in between. One of the unique points I think for Connected Health is they actually understand healthcare, they understand our needs, and can then bring together a range of technology partners to help solve a problem for us. We've bought over 2,500 SpectraLink Versities, different mix of 3G, 4G, Wi-Fi, some with scanners, some without, really to meet all of our different needs, whether it's role-based, issued to an individual officer, to ensure it meets the full range of communication needs across the territory. Before we had the SpectraLink Versity units, it really was like seeing our staff like tradesmen. They'd walk around with a tool belt full of half a dozen different devices, whether it was a pager, a mobile phone, another Wi-Fi based phone, and various other communication tools such as two-way radios. Going to a single device really has made it much easier for those staff members. They carry one device that does everything they need and is simple and easy to use.
In the healthcare environment, it's important to have a device that's fit for purpose. We're using the SpectraLink Versity for voice over Wi-Fi communications and utilising that through our various sites within the territory. With over 2,000 devices, it's been important for us to have a platform which we can provision quickly SpectraLink handsets to our clinicians and to our operational spaces. We've used the mobile management platform to deploy our handsets. My team of subject matter experts who are managing the platform find the system easy to use, manageable, and very scalable to deploy device, from 5 devices right through to 200 through to 500 devices quickly and efficiently, or deploy packages through the Android Play Store. Over the last 5 years, we've worked with Connected Health on various projects, including deployment of the SpectraLink handsets and also asset management tracking systems for tracking high-value items like workstations on wheels and wheelchairs.
In the case of ACT Health, they approached me when they were looking for a Duress solution, and this enabled me to offer the use case of Duress and man down for ACT Health.
Since we've moved to Alcatel-Lucent Enterprises and some of the solutions they're providing for us, such as messaging and Duress, we've really seen it refine and get much easier, so clinicians now simply have one device to go to that can do everything they need. If there's an emergency, every single second counts, and the ability for staff to immediately raise an alarm and have somebody who's responding know exactly where they are, which door or which corridor to go down to get to them safely and quickly, has been a boon for our staff members. It really means we can get to them first time, every time, to provide that support they need immediately.
Making sure that the ALE message is sent and received very quickly and to the right people is really critical to the safety of our staff, all nurses and midwives. This is one of the things I'm most excited about, is the future of what we'll be able to do with the SpectraLink Versity devices. When we go live with the digital health record in November this year, we'll be rolling them out to every nurse and midwife who is on shift at any time across the entire territory.
What we're now looking at is how do we expand that across the public health system, but also how do we move into the community more. We're moving more and more of our services and our staff into the community. How can we take these same solutions that we're using in wards now and for a small number of staff in the community and expand that across our entire workforce across the ACT?